Thank you very much. Thank you all for coming today. Assalamu alaikum wa rahmatullahi wa barakatuh. Before I start my talk, I would like to thank the organizing committee, the scientific committee, for this tremendous effort in organizing this amazing meeting. And I'm very proud to be part of this activity. And when we are talking about this time around the year, there are so many changes that has happened during last few years in the kingdom, and I'm very proud to be part of this change. We are going through. I don't know how to change this. Okay. So in Saudi Arabia, it is a very exciting time in Saudi Arabia now. We have the vision of 2030, and we are all nationally working towards creating an amazing vision. We are also proud to be part of the new model of care that has been launched by the Ministry of Health this year. And we are so proud to be a part of this amazing society, the Saudi Spine Society, that, as Dr. Khalid mentioned, which is multidisciplinary and take care of health of people with spine problems. And when we talk about health, we all know that health is not cheap. And according to WHO, the 10% of global GDP is actually spent on health. And health, how this cost is impacting individuals or population health outcomes is a question that needs to be answered. How are we doing in terms of caring for our patients? We know that spending has increased in the past few years, and I share with you this from the North American data. The spending on spine care has been increased in the past few years. However, the disability in musculoskeletal in general and in spine in particular, it still continues to rise. So what are we doing wrong? And I think we need to think about our care and our spending. Are we spending our money in the right place? And when we talk about health and the impact on health, we need to look at health from different domains. When we want to measure health, we want to look at physical, social, and mental as well. Not only on an individual level, but on a population level. So what are the tools that we should use to help us look at the cost and look at the impact of our health? The tools have to measure change over time on an individual level and on a population level. They have to be meaningful to the population and for the individual. They have to support collaborative decision among different disciplines, and they have to be culturally sensitive. And this is an example of how outcome measures has been used in different sectors or in different domains. For example, the North American Spine Society stressed the importance of using outcome measure or selecting the appropriate outcome measure in their guidelines. Not only in guidelines, but also in registries. For example, the British Spine Registry stressed the importance of outcome measures in, to gather data on how are we doing with spine care. What type of measures we need to choose? Are we looking at dimension-specific measures where we focus on particular aspects of health, or are we looking at disease-specific, or are we looking at generic kind of measures, or we want to look at individualized measures that look at certain aspects of individual life, or are we looking at rule-specific, or how are we utilizing our care? So we need to ask ourselves this question before we select the outcome measure, appropriate outcome measure. An outcome measure to be appropriate, it has to have a common language and terms and concepts since we are talking about multidisciplinary care, we need a tool that promotes this common language, and we need a tool that is structured and can organize data in a structured way and a standardized way. We need also a tool to be multi-purpose that can be used in different settings and different health disciplines, and that also it needs to be supporting the right-based policies. And what better than International Classification of Function, Disability and Health as a framework to select the best outcomes for our healthcare. For those who are not familiar with International Classification of Function, or ICF, it has been established by WHO, and it replaced the old ICF that was established in 1980. The ICF has been shown to be to promote biopsychosocial approach or model of care, and it has been shown that it is a good framework for multidisciplinary care and in different health settings. And as an example of using this framework to come up or to select the best outcome, the AO Spine, for example, they have worked on spine trauma patients' measurement, and they went through different phases. They prepared the preparatory phase where they looked at the evidence and consulted the experts, and then they come up with a core ICF categories, and then they developed a tool to measure, to use as an outcome measure. And this is an example of how they use this framework in order to come up with these core categories that needs to be measured. For example, in body function, they looked at energy, sleep function, etc., activities participation. We look at dressing, activities of daily living. When we talk about the contextual domain, environmental factors, we're talking about personal consumption and support and relationships. So this is an example of how this framework helped in generating number of outcome measures. And this is another example of some of the tools that can be used in, as outcome measures. And these are all Arabic translated tools that has been validated and showed high reliability in spine care. And so what to do with the data? We can use it for clinical research, economic analysis, evidence-based practice, clinical applications. And we need, in order to select the best outcome, we need to go through a certain process. We need to ask ourselves, why are we selecting this measure, and when do we do this measurement, and what do we measure, and to implement and evaluate. And the Saudi Spine Society is in a best place to support outcome measurement using biopsychosocial, culturally applicable and valid, reliable, sensitive, meaningful, multidisciplinary outcome measures. And the take-home message here is outcome measurement is a key for consumer-centered valued model, and outcome measurement must be culturally applicable, meaningful, valid, and reliable. Thank you.